Hello and good morning or good afternoon, I should say. And welcome to our third of our healthcare CX innovation in healthcare series. We're going to be talking about technologies, tools, and strategies for enhanced patient and customer outcomes. Uh, with that being said, I want to make sure that first some housekeeping. If you have any questions, please feel free to add them into the chat and we'll get those added and hopefully answered for you quickly. So without further ado, I am going to introduce, I am Karen Dupree. I will be facilitating this webinar. And I am so happy that we've had our partners with Zappix join us. But at first, let me go ahead and have you guys say hello to Matt. Matt, if you could introduce yourself, and then we'll go on to Christine.
Thanks, Karen, and good afternoon, everybody. My name is Matt Grintes. I'm BPA's Director of Reporting and Analytics. Most of my purview is in using the technology that we'll be talking about today, so I'm very excited for our discussion and to see if anyone in our audience has pursued similar journeys with their own technology. Thanks, Karen.
Mm-hmm. Hi, everyone. I'm Christine Clarkson. I'm Vice President of Healthcare Solutions, and I have over 20 years of healthcare experience, including working, with PBMs and specialty pharmacy in the 340B area, disease state management, patient assistance programs, as well as, of course, patient care. So I'm lending my expertise, with healthcare to really add value to the conversation today, about elevating the patient experience and technology. So welcome, everyone.
And on to our special guest with Zappix. Ladies first, Valerie McSorley.
Hi, Karen. Nice to be here today. I'm Valerie McSorley. I work with Zappix and coordinate strategic partnerships. And we're so proud and happy to be a part of this and work with BPA to help solve a lot of the healthcare challenges. So we're looking forward to being here today. Thank you.
And last but not least, we have Yossi.
Hi there, I'm Yossi Ebrem. I'm the CEO of Zappix, and thank you for having us, and I'm looking forward to a great conversation.
Fantastic. Thank you so much for joining us today. What we're going to explore during our conversation is CX innovation in healthcare. We're going to dive deep into advanced speech analytics, and then ultimately coming up on improving patient outcomes and customer outcomes. So just to start out with a little bit about BPA and why we're talking about healthcare. We've worked with many healthcare companies throughout our 30 years of experience, not only training, but also doing quality monitoring and customer experience. As you can see here, we're HIPAA compliant, and we've just had a lot of experience within the industry and want to be able to share insights that we've uncovered over our 30 years of experience. And I'll pass the torch on to Christine.
Thanks, Karen. Mm-hmm. As you're all pretty aware, we have some challenges, that we face in the healthcare industry, that impact the patient experience. And listed here are just some of these challenges that you're facing, as you strive to meaningfully, impact the patient experience and the patient journey. With looking at these, are there any other challenges that you're facing, that are not listed here? You can always put that into chat. And which ones are important to you? Is there anything kind of missing there?
Yep. We do have a question that came through. So are there any challenges not listed here that may be experiencing?
Is there anything there? So I know that some of the challenges that we can face is with refill medications as well. We'll be speaking to some of this, later today on how technology, can be used to increase, the patient communication and make it more successful, so as to offer, a greater patient experience, that will keep our patients, more compliant to therapy as well. So there'll be more to come on that later today. Also, I know. Sorry, Karen.
Oh, I'm sorry. I didn't say anything. It sounds like we had some background.
Yeah, no worries. Thanks. I also know from my own experience that appointment scheduling, is an area that is a huge challenge. Even with the current technology, that most facilities are using, there's still a number of breakdowns, which cause disruption to the physicians and medical team coordination. And that can be quite costly to the facility, in addition to, frustration, the patient feels. I mean, a crucial part of any patient journey, as we know, is healing. And we all have accountability, being in healthcare to ensure that, we champion the patient journey, and addressing these issues is crucial for improving, our patient outcomes. So today we're going to be reviewing technologies and strategies, that can streamline our processes, drive more efficiencies, enhance that patient satisfaction, and then really improve patient outcomes. Let's go into the next slide, Karen. So there's a variety of technology, that can help us improve our processes, efficiencies, and solve, for some of the challenges that I've just reviewed. And many of the companies, may be utilizing, some of these technologies, maybe all of them, or perhaps, none of them. Can anybody share what technologies you're currently, using or looking at? You can put that into chat. I'll give it a minute. Anything there?
Actually, we do have a couple answers here. We are currently doing manual call monitoring for our patient care coordinators and are looking for some AI to help with this.
Okay. I mean, yes, AI can certainly assist in this area. I mean, all quality call monitoring, can be enhanced, so much more with the use of these technologies. QA technology can provide efficiencies to managers who have, historically spent countless hours, listening and scoring and trying to analyze, the patient calls. I mean, effective QA technology can really increase your agent's performance by identifying areas of needed improvement, and free up that valuable manager time and increase the volume of calls being monitored, which is invaluable, for HIPAA compliance. Matt will be covering more of that today as well.
Okay. And we had another one come up that so it's looking to be able to understand the issues and trends better from what our patients are saying during their calls with us.
Oh, okay. Yeah, at times I know we can get overwhelmed with the amount of data and the information and making sense of it all. And, and what is it really telling us? And how do we go beyond those traditional, quality, call metrics? And this is where AI and psychometrics and speech analytics, can be utilized to complete this, this large jigsaw puzzle of information that we can find ourselves with. So these tools can really help us understand, this jigsaw puzzle better. And they allow us to uncover, these nuggets of insight and identifying trends that impact the patient experience. So Matt and Yossi, they'll be speaking more about these tools today as well, that can assist in this area. So yeah, great question there. So just to round out, so with these technologies and strategies, that we will share with you today, you can realize benefits, not only to the patient experience, but to your operation and your revenue ROI as well. Next slide, Karen. There we go. So yeah, let's just get started and we'll take a look at these technologies and solutions, to some of the many healthcare challenges that we're all facing and how we can resolve them. So on our next slide, let's take a look at, here we've got, tech investments. It's very exciting. It's new technology. We have dreams of, what it can do for us. It's bright, shiny, and new. We've bought this fighter jet and we're very excited about it. Many of the technologies, that I've mentioned, your companies may be, thinking of purchasing them or already have them and perhaps utilizing them in various ways. You've got this new technology. You've been buying, the fighter jet. So that's exciting. And then on our next slide, you might have realized this as well, because many times, we buy a technology, based on a promise or, perhaps a dream of what the tool, or in this case, that fighter jet, will do, and it will fly itself. But we quickly learn that, it won't, and that we're flying this jet, a little blind. So we end up, only utilizing, a small fragment of the technology as we don't really fully understand its capabilities, and our dreams are not realized of what it could do for us. it can certainly be overwhelming, and, really expensive to navigate, the intricacies of technology. And if we get it wrong, we can end up with, a disjointed, robotic, and transactional experience for our patients. And our ROI is not realized, and our patients are, even more unhappy and frustrated with us. So, has anyone bought the fighter jet? Probably some of you. Well, if you have or are thinking about it, it's always wise to partner with experts, who can deliver the results, you're expecting. We're here to help you, navigate these technologies to ensure the technology capabilities, and the dream is reached there. But with introducing, you can go into that slide, Karen. With introducing kind of new technology, we can't forget that human element and the importance of making that connection with the patient and their goal of being well. That human touch is critical for the success of the patient journey. And as humans, unlike technology, as we know, we can be creative and intuitive and show real empathy and understanding so as to connect with the patient. And as we all know, the balance between technology and that human element is crucial for patient care and overall satisfaction. So as we move into, reviewing some of these technologies next, the human element is always considered and balanced as well. So Matt, I'm going to hand it over to you now so you can share with us, your expertise on some of these technologies.
Thank you, Christine. Can you hear me now?
We can.
Wonderful. Okay. So yeah, I'm excited to speak about my two favorite technologies in the contact center world. These are where I spend the majority of my time is talking about and utilizing and helping our customers maximize the value from each of these two technologies. And they are very similar. Auto QA or automatic quality assurance or analytics and speech analytics are both built from the same technology, really. They're all about either taking the audio files themselves or transcriptions of those audio files, processing them, and then doing some sort of analytic step to extract some value from that exercise. The differences are really in how they're utilized most effectively. So auto QA we consider to be an enhancement to the traditional QA process that you likely already have within your organizations. And we'll talk about some of the benefits of auto QA and why everyone should really be thinking about a move towards incorporating auto QA into their traditional quality space. And then for speech analytics, which is more used to categorize or tag interactions that meet criteria, which can then be queried and utilized in other ways beyond just the data collection. And we'll spend a bit of time talking about some of the challenges that can be approached, understood, and solved using these two technologies, and where some of the most value can be found. So we'll just move on to the first section, which is really focused on auto QA. And we'll start with, what are the challenges faced by healthcare quality organizations today? And really, this isn't necessarily unique to healthcare. We see that organizations within every vertical have similar challenges. And that is, while there's great value in having a traditional QA program to gather insights and understand representative behaviors and caller frustrations and pain points, there's also the massive investment. So it's a lot of time commitment to extract value from a manual QA program. That is one of the key limitations, but there's also blind spots. As we know, we are limited by the bandwidth available from our evaluator teams in order to conduct a manual QA program. Typically, the number that we hear often is 1% is the maximum volume that we can really assess manually. 1% of all interactions handled at a contact center are possibly available for manual QA. And so that does leave blind spots. It leaves risks, since we're leaving 99% of all interactions unreviewed, unassessed, and we don't know necessarily what's happening in those interactions. And so that's why we'll talk a bit about some of those benefits of auto QA. On the next slide, we'll talk about why auto QA to the rescue, really, right? So this is where we have an opportunity to expand our program, expand our reach. The biggest benefit is that 1% figure goes right out the window because now 100% of interactions are in scope for QA. It takes no more time to process 1 million interactions as it does one interaction once we have the tool set up to be doing what it's supposed to be doing. the hybrid model, where we have a portion of each evaluation completed automatically, and then a portion of each evaluation completed by an expert assessor or evaluator, gives the greatest value. This way, you get the reach of 100% of interactions for those attributes and standards that are measurable through AutoQA, while earmarking for manual intervention those evaluations or those standards and measurements that are outside the capabilities of the AutoQA function. So important to maintain a very strong QA team. We're not talking about replacing your QA, we're talking about enhancing it, allowing that team to do even more with the same amount of time. And that's really the third benefit. It's the time savings per evaluation. So no longer are our teams tied up in gathering the minutia of, was the greeting followed? Was the closing followed? These are things that we can automate and spend zero time on for each interaction. And instead, evaluators' bandwidth can be reinvested into problem solving. What are the calls that are problematic? Where can we gather intelligence that's really going to move the needle on patient experience or customer outcomes? And of course, there's also nearly limitless potential for what we can measure through AutoQA. Think beyond the confines of your existing quality program. We're not limited to just looking at general process adherence, soft skills. Really, we can track anything specifically. We can look for example, we can look at mentions of competitors. We can look at brand value. We can look at where our patients feel grieved. And all of this can be done outside the confines of your traditional quality program just by adding tracking measurements to your AutoQA. So it looks like AutoQA can do everything for us, and it can do quite a bit. So we'll talk a bit about some of the specific benefits of moving to an AutoQA or hybrid program. The first of those is we can massively increase the scope. So we've already talked about how that 1% number flies out the window. We can massively expand the scope and the reach of our quality program and measure everything that fits within the briefing of a good QA question. We'll talk about what makes a good AutoQA question in subsequent slides, because it is somewhat limited in the range of questions it can answer effectively. So we need to sometimes rethink how we're asking questions in the quality space to better suit the technology's requirements. Risk identification and reporting for intervention are also key benefits from AutoQA. There's no longer any limitation on how long a call can be. Right now, most traditional quality programs have some sort of a cap on how long a call can be to be considered in scope for evaluation. That's again tied to the evaluator bandwidth and the necessity of touching as many calls as we can with a limited time. So often longer calls, which may contain more rich conversations or may contain more problem areas or deviations from procedure, are often a blind spot in quality programs. And so an AutoQA program allows those long calls, hour-plus long calls, to be considered in the same amount of time as a 5-minute interaction. There's also no delay in the evaluation completion. So while traditionally manual QA programs look back several days, with AutoQA, it's scored in real time. As a recording and a transcription are available, they are measured against the standards that we set up. And that allows for immediacy and speed to action. These are very easy to customize. Questions can be built as long as they meet the briefing for good AutoQA questions. Everything can be visualized in all of these tools across the marketplace. Filters can be applied with multiple forms created to really give a focus on the most impactful interactions, including the customer experience and patient outcomes. So moving on, Karen, to the next slide. What makes an AutoQA question? So we talked about fitting the briefing of a good AutoQA question. It's only good at asking and answering certain types of questions, and we need to consider that as we're developing a program. That's not to say that that there are things that you can no longer assess through a quality program. And that's why we recommend hybrid approaches. For those very detailed or challenging behaviors and standards, we often recommend having an expert human listener come in and assess those adherences. But what we'll talk about is the best AutoQA question need to be verbalized. This is a key. We can't rely on screen recordings or research into a customer relationship management tool or anything like that. We're really reliant on what's present in this transcript or what's absent from this transcript. Presence or absence is one way that we like to think about things. And that's why number 2 is about binary outcomes. It's hard for us to use a multivariate scale with AutoQA. And so often we rewrite questions that might have potentially a dozen different responses, and we turn those into a dozen different questions, each one asking for presence or absence of a particular element. It works most effectively with standardized processes or procedures, so those that don't require complex decision trees or have potentially multiple viable outcomes. So these are typically more challenging to automate. Not to say that they cannot be automated, but they may need a greater degree of creativity and development time in order to effectively measure through auto QA. And finally, no deep contextual understanding can be required. So really, we're looking for more surface level, more let's say, I don't want to use the term simple because we know that the processes themselves are not necessarily simple, but those elements that can be observed at the surface level through just the conversation between representative and patient or member or caller. So if we move on to the next slide, what can auto QA really be used for? We talked about it. Expanding the reach of your traditional QA program. The types of elements that are most successfully translated into auto QA within healthcare in our own experience are things like HIPAA compliance and authentication. So there's typically a set number of identifiable pieces of information that need to be gathered by representatives. That is a very suitable task for auto QA to accomplish.
And I think that's really a big one in healthcare as well.
Absolutely.
I mean, it's absolutely imperative that we're, fully compliant. And at times, with quality assurance, we can't monitor all the calls, but with this, you can for compliance for HIPAA. So it's really key for that. That's great.
Yeah, and we know that that carries a ton of risk, right? So if we're not maintaining that HIPAA compliance, of course, we might end up running afoul of government regulations. So there's all sorts of considerations there. And we talked about the blind spots from that 1% through traditional evaluation. This allows us to gain visibility across the entirety of every interaction handled within the center. Greetings and closings I already addressed as being relatively rote steps within the interaction. And those are typically very suitable for automation. And now we've saved a few seconds and a few clicks on every single assessment that our evaluator teams are completing. Hold and transfer processes are another element that's quite suitable for automation. Egregious behaviors, if they can be identified verbally, are another key area. And this is a huge benefit for risk-based reporting. And every call that flags as an egregious behavior for one reason or another can then be queried for manual intervention as needed. Sometimes these patients need to get a call back to be if incorrect steps were taking place during their initial interactions. And so this type of procedure allows access to and identification of those problematic interactions so that corrective steps can be put in place.
So it really helps kind of find those nuggets of, insight and trends as well. It kind of leads to that as well. So
Absolutely. Yeah, absolutely.
So you really understand what's going on with the patient journey. Yeah.
Right. And beyond what we have on the screen here and what you're already measuring through your QA programs, just remember, as long as the question fits the brief that we discussed a bit earlier, what makes a good auto QA question, that can also be added in. And you can think about this as a modular section in a call form. So what is the hot topic of the moment? Let me program some tracking auto QA questions to start to quantify, understand the geographic splits, the hierarchical splits, whatever it is that we need to do to understand the size and scope of an issue. And that can be done relatively simply and then applied to every single interaction along with the other set of standards that we're programming.
So it can be really tailored to maybe there's a new rollout of a drug or something like that, or a new program, and we could really tailor the questions and the observations then on how that's going.
Absolutely. And we know that there's even a seasonality to a lot of healthcare, right? Open enrollment periods come to mind.
Correct.
And when there's a big press and a lot of new members, for example, calling an insurer, having key trackers in place to understand the content of those interactions, the frustration points from those members or potential members, there's so much value that can be derived from using auto QA and speech analytics for these specific topics as they arise. So really, auto QA, I think in summary, is a great way to expand the reach of your quality program, to expand the scope of what you're measuring through that quality program, and to free up bandwidth from your expert evaluators to do the work that AutoQA can't do as well. The human element. Are we giving the right level of care? Are we following procedures exactly when they are complex decision trees? So those things that fall outside the strengths of AutoQA. And next, we'll talk a bit about speech analytics. This is my favorite of these technologies that we'll discuss. So speech is often sold as the tool that's going to revolutionize your call center. And obviously, it can be that, but it really can't do that on its own. It needs a bit of a push to get us there. So what does speech do well on its own, out of the box, with just some basic setup? Well, it does. It is good at counting things. How often is a phrase used or a word said or a scenario uncovered through an interaction? AutoQA is a very powerful tool on its own, but we talked about how combining it with a hybrid model, so having humans come in and listen to those elements that are outside the scope of AutoQA, is a very powerful methodology. And we'll discuss how a similar methodology should be deployed for speech analytics to maximize the value. Speech is good at organizing the data. So if it's an input, then it can also be an output. Anything hierarchical, geographical, chronological, anything that we're including in metadata can be used to help understand or organize the data that we're collecting through speech. And finally, we can visualize those changes over time. So how are these volumes or rates of things changing as we collect more data, as calls are handled and manually or automatically processed through speech analytics? They're added to these buckets, and we can see the shape of those graphs changing over time and where we may need to apply some additional input. So next, on the next slide, how do we enhance this? So we saw what it can do. It can count things. Is that really useful for us? Probably, but is it the solution to the problems? That it is not. And so that's why we recommend adding on a layer of expert human listening. And this is where we use speech as the driving force. It's counting and it's bucketing the interactions. But the next step is to then interrogate those interactions to find out really what's the cause of the issue. What is the root cause at play here? Well-trained evaluators who understand the needs of patients, members, providers, and also understand the demands and the challenges put on contact center agents. Those are the folks that can really help transform speech from when or how often is something happening to why is it happening. And we'll talk a little bit more about how to make that transformation.
So you're really saying, Matt, that you really need kind of that balance between the technology and that human kind of observation as well.
100%. And it's the same for AutoQA, where we recommend that hybrid form approach. Here we recommend speech plus human listening. And on the next slide, we'll show that there's strengths to each. So on the technology side, Karen, if you just move forward, on the technology side, we show some of the strengths of speech analytics on its own. So basic process adherence, certainly something that it can measure. If we think back to our AutoQA discussion. Quantification of how often things are happening or not happening. Focused inbox, so that's the risk identification and moving those calls that require manual intervention to a secure location for that purpose. And then that real-time reporting and analytics. So speech does all those things very, very well. And we consider it the breadth. It's great at looking at 100% of your interactions and finding out how many of them are relevant to the topic that we're studying. On the other side of the Venn diagram, the expert human listening is where we can get beyond what the capabilities of speech are. And this is where we really transform from just using technology to using technology well. Soft skills. So what are the intangibles? What are the things that are taking place? I wouldn't say non-verbally, but let's say between the lines of our conversation. Is there a complex or a very detailed process in play here, in which case we can't measure its true effect or our true adherence to it through AutoQA? Volume is limited, of course, with expert human listening. That is one of the limitations that we talked about at the start, but that gap is bridged by using speech analytics. So really the value is from the center of the Venn here. We combine the breadth of speech with the depth of human listening, right? It gives us the most bang for our buck. We can use speech as an example to identify the calls that require further investigation and then investigate those very specifically. A traditional form in your quality space probably has all sorts of general process adherence, soft skills, things like documentation. None of that's really going to help you get to the root cause of a specific issue. And so within this process, one of the key components is in developing a custom set of metrics. So think of it as a call form that's specifically designed to solve one specific problem. It may take a 12-step procedure and break it down step by step for our assessors to evaluate at what point was where was the point of failure in this process adherence. It could be used to understand the caller's frame of mind or their emotional state, which may be something that's outside of scope for auto QA, but might help us make better decisions in handling similar calls in the future. Could also be used to help identify the behaviors or steps that are most commonly resulting in repeat contacts. And of course, in every industry, we're trying to reduce those repeat contacts and improve first call resolution. So really, the combination of speech and human listening for those business insights studies is where we find the most value in our healthcare customers in utilizing this technology.
Yeah, it's really important to really pinpoint as well, as you said, that root cause and where is that actual pain point for the patient? Where is that and how can we remedy that? So that's really going to help with that. Thanks, Matt.
Right. Yep. And so we'll talk a bit about some of the problems that we can solve using speech. These are some of the challenges that our healthcare customers have handed to us and said, see what you can figure out with speech around these topics. How can we reduce these issues or mitigate them? So long call durations and repeat contacts. Again, this is not industry specific. These are challenges across the board in every industry. And so a lot of time is being spent in developing models for understanding long call durations and repeat contacts and investigating those very specifically to understand what made this call longer than the average for this call type. What drove this customer or this member or this patient to call again in future unnecessarily. In some cases, it can be used to supplement call type identification or caller sentiment and emotion. And you may have those data points elsewhere, but speech can also be used for that type of rote reporting. The step-by-step procedural adherence is obviously a very big one. We spend a lot of time in R&D building good processes and procedures for contact center agents to follow. But sometimes they just don't follow them and we can't figure out why or at what point in the procedure they failed to take the right step. And so doing this type of investigation where we're very focused on a very narrow range of problematic interactions, we can truly point to the actual root cause. Where was the point of failure here? And for healthcare specifically, patient grievances, patient dissatisfaction, these are areas of strengths for this type of engagement model. So using speech to identify those instances of patient grievances or dissatisfaction and using that team of human listeners to go in and investigate why was this patient so dissatisfied with their service and how can we improve for next time. So really there's a ton of potential for using the combination of these two skill sets, this technology plus this the bench strength of an evaluator team that's expert in all the areas of the business and of the contact center. And this is where we have had great success with our customers in solving problems like those on the screen.
Well, one thing to add into this is that this doesn't only help with contact centers and the management of this is great for marketing departments, finding out, what is the grievances, what are people saying, and to be able to utilize this not only for, as mentioned, the marketing department, the legal department as well, to really follow through and figure out what's the best way through the customer journey as well. And being able to get these little golden nuggets of information by doing these insightful reporting is a great way for the company overall to be able to provide the best customer service.
Mm-hmm.
Great point, Karen.
Mm-hmm. And so if I could leave you with some parting words about speech, I would say remember to use speech not just to count things. Remember back to Christine's fighter jet allusion at the beginning, right? You've bought this tool. It's very capable. It can do a lot of things, but only if you're using it in the right way and with the right mindset. So remember, use speech as to keep an analytical eye on problems that you already know about. That's one of its clear strengths right out of the box. Identify the new and emerging trends, and combine speech plus listening to really maximize your value and understand the root cause of problematic issues. And so, yeah, that's where I would leave you. And I will say we'll hand it over to Yossi next to talk about the AI-powered digital engagement platform. So,
all right. Thanks, Matt. I mean, these technologies, really help with improving the patient journey and can, help with the patient outcomes as well. So, but you're right. I mean, it's back to that fighter jet. Are we flying our fighter jet? Or are we flying blind right now? So if we have these tools, it's how are we utilizing them? And if we don't have these tools, it's, well, kind of, why not? Why aren't we going down this path of technology and innovation? So yeah, great segment. Thank you. So our next slide, we're going to start looking at our next technology, and it looks at, what a patient digital engagement platform, can do for us to improve, our service, with our patients, and we've partnered with Zappix Healthcare, on this. Move on to the next one, Karen. So Zappix Solutions, they can transform and optimize the patient journey by engaging through, digital outreach, deflecting inbound calls using self-service, and optimizing patient care coordinator activities, using a digital assistant. And these technologies allow for improved patient access. They'll increase, KPI performance and improve, process efficiencies as well, which really results in greater patient satisfaction. So Yossi's now going to be discussing with us all these technologies and the value that this can add to your organization. So Yossi, I'll hand it over to you. Thanks.
Thank you. Thank you so much. So a couple of words about Zappix and what we provide, and then afterwards we'll go into the different aspects of the user journey, patient journey that we are addressing. So we are AI-powered digital engagement platform. That's what we provide. And as the previous slide said, we're all about prevent, deflect, and optimize. And we do it using our three main products: digital outreach, which is a very comprehensive digital proactive outreach to members, to patients, to consumers, using text messaging, emails, automated phone calls, and so on, omni-channel, multi-touch points, and so on. The second component, or the deflection, if the call does come into the contact center, is how do we help our clients provide self-service, digital visual self-service to deflect some of those mundane, repetitive, low-value calls coming into the contact center. But if they do reach the agent, can we help the agents improve, optimize that interaction? And that's what we do. So we're here to help improve the customer and patient satisfaction. But if you move to the next slide, but we don't forget all the time the elephant in the room, that when we're talking about healthcare systems today, there is a major financial challenge, and majority of the healthcare systems are really challenged to get to profitability or even to break even. And we see it day by day that how we are, most of them are sometimes have to reduce manpower, some of them have consolidation and so on. So, well, we deploy our solutions, we keep that in mind, that we have to show financial outcomes for them too.
Yeah, I mean, I know all healthcare facilities are always struggling with, with the revenue and the expense side of it, with cuts and everything. It's really difficult. So anything that can improve, ROI will definitely be welcome. So yeah,
yes,
definitely hit it on the head.
So our solution is comprised of a solution for the contact centers, and this is where our digital visual self-service is coming into the picture, where we deflect calls, and we work with over 50 different contact centers, mostly in the US, but around the world too. And then the second part, which is really tailored towards the healthcare systems, the providers, is a very comprehensive digital engagement platform. So if you go to the next slide, the main benefits and the outcomes we bring to our contact center clients is very significant cost savings, because we can help them deflect calls, those mundane, repeatable calls that are coming in, and we can help them move them into a very successful resolution bots, we can call them, end-to-end resolution bots that are deflecting 10 to 30% of the calls coming into the contact center. We do our average containment rate, the number of successful resolutions is over 75% across our clients. And we all know also that how difficult it is today to recruit, to maintain, to reduce churn in the contact centers. So we are not preaching to any contact center to reduce their manpower, but the main emphasis is helping them overcome their shortage of staff. How can we help them push more calls to the self-service instead of those vacancies that they have today? And of course, improving KPIs like average handling time, average wait time, NPS, and so on.
So this would really allow the patient care coordinator to, not have all of these calls coming into them, because then the patient calling in could then answer their own question through the self-service platform.
Yes, exactly. And for example, where someone calling in and they have questions about directions to the facility, or they want to reschedule an appointment, or they have certain questions about logging in to the platform that they're supposed to use. Any of those questions coming in that are not really high value to the organization and that we can automate the response are great candidates for that self-service.
Right. So that means your patient care coordinator, when they are taking calls, those are those more high-risk calls that really need that human element and that human touch.
Yes. Empathy, complex, human touch required.
Okay, great.
And then for healthcare systems, we provide a digital patient engagement platform. And it really is a high-quality digital engagement throughout the entire patient journey, from the patient acquisition phase, when we want to do all the patient outreach, reminding people that they have a referral but have not yet scheduled an appointment, through all the preparations before a visit. Reminder, you have a visit in 2 days, 4 days. Reminder, you have a procedure that requires you to do certain preps, like a surgery or a colonoscopy, that you need multiple days of preps. And if you're not starting the preps 7 days before, and you get a bland reminder 24 hours before, basically you cannot do the colonoscopy. And then it's either a late cancellation or a no-shows. So everything around the section of the before visit, the purpose there is reducing no-shows, reducing no-shows, reducing no-shows. And we have great success in that aspect.
Because I know a lot of facilities as well, Yossi, I mean, they have large amounts of no-shows, and it really can impact, the ROI for that facility as well, because they're expecting the patient, to come in for that procedure, then they don't. And, it's underutilized, really expensive resources at the facility. So
exactly. So it's a high cost. They lose the revenue from the insurance companies for those procedures. It's also staff morale, because they came in and now we didn't complete it. And from a patient care, now they need to delay a service that they were supposed to receive today. They need to delay it, and who knows if that will end up in any type of.
And it really doesn't help patient outcomes, because there could be a time when they don't actually get that procedure done then.
Yes.
And that's not helping them in the long run either.
Yeah, and then during visit, everything to automate the digital intake process. Instead of having those clipboards with the forms and so on, we can digitize. We are digitizing and helping them do that. And post-care, reducing readmissions and receiving the voice of the patient by outbound, by pushing out surveys the day after an appointment. Mm-hmm. So the outcomes that we see, if you go to the next slide, are significant, both financial and patient experience outcomes that we provide to our clients. First and foremost, reducing no-shows and late cancellations. And it can be several clients we have reduced no-shows from 15% to 6%, from 18% to 9%. But we see very significant reduction in no-shows every time we deploy this solution, no-shows and late cancellations. We're also trying to help our clients by automating certain manual tasks that their staff are doing. For one of our clients, it was a manual call that they did the day after every appointment, to make sure that the patient is feeling well and so on. So we automated all of that for them and made sure that the patient is responding. And only if they are not responding, only then they need to make a phone call. So really taking those user journeys or patient journeys, mapping them out and helping them automate as much as we can. And collecting patient inputs. If you move to the next slide, we collect patient inputs through our surveys, and it's being proactively sent out in an omni-channel text, email, QR codes. We collect the information. It's great input for the healthcare facility. I'm always surprised with the response rate we get from the patients. And I think they are responding to it because they have received multiple messages before and they see the value of it. So now they are also much more engaged with the facility, with the practice, and they are responding to it. And we see very detailed surveys about their experience there. And we also attach it to like the Google reviews and allow them to leave Google reviews. So that helps with the competitiveness of that practice. So to summarize, if you are experiencing any of the 7 text boxes that you see here, any of the issues that you see here, if you have a high no-show rate of 5%, speak with us. If you have a late cancellation of 4% and above, speak with us. If you experience any type of that you feel that you're doing too many things manually, speak with us. And that's basically the signals that we're looking for when we're talking with clients and prospects. These are the signals that show, yes, there is a place for improvement in the way we are managing and handling our patient journeys. Thank you.
Thanks, Yossi. Thanks for all of that. That was great information. So, at the start of today's webinar, we reviewed many of the challenges, present in healthcare today. And as you've seen from the technologies, what we've discussed, that many of the challenges, can be solved, with the available technology. And you're also flying your fighter jet with expertise. So your healthcare facility, be it a pharmacy or a PBM, a hospital clinic or payer, or even some pharma manufacturer company, can benefit from these technologies so as to improve your patient experience. The outcomes, from these technologies, range from increased, HIPAA compliance, improved patient access, increased patient satisfaction, improved KPIs in that performance, and greater process efficiencies. And all of these lead to an improved, an overall patient experience, which is what we're all striving for. Next slide, Karen. So how can we help? Get out of transactional manual call quality assurance and move into the AI age, with these technologies, so as to free up your patient care coordinators, your agent time, improve your KPIs, and optimize the patient journey. Don't be flying blind. We are here to help you, to fly your fighter jet successfully. So we're here to help. If any of this sounded interesting to you, we're happy to assist you and your team at any time. So thanks, everyone.
Thanks, everyone. And all the fighter jet themes this afternoon makes me think about Top Gun, and we want to keep you out of the danger zone. So in more ways than one, it can be scary to go into new technology, but also with your bottom line, some of the stats that Yossi shared with reducing no-shows really shows up on the bottom line. So in one of the cases, we were able to take an organization that had a 15% no-show rate down to 5%. And that really landed in a savings generated over $2 million of procedures that would have gone otherwise unperformed. So there's some serious money behind recapturing some of the no-shows. So as you see on the screen here, we'd love you to scan that QR code. and it's going to take you through a series of questions. It will take you no longer than 30 seconds to fill this out, and it'll be a great way for us to pinpoint what the challenges that we can help you solve. So we want to thank you so much for joining us today, and we'd be happy to answer any questions you have at any time. Thank you so much for the opportunity. Thanks to our friends at BPA Quality for hosting this. Thank you, Yossi. And we look forward to learning, connecting, and sharing more with you in the future.
Excellent. Thank you, everyone, for joining us. Have a wonderful afternoon.
Thanks, everyone.
Thanks, everybody.
Bye-bye.
Bye.